Margaret Boucher has experience with PMS and Candida, a very extreme case, and started, you were telling, I guess now that you have hindsight, which is always perfect, you know it started about when in your life?
Yes, when I was about 6 years old, my teeth were done with gold and silver fillings, and subsequent to that, within 18 months, I experienced a lot of kidney problems for which I was given several courses of antibiotics. Went on, that suppressed it, and went into ear, nose, throat, tonsillitis, and more antibiotics. And in high school, experienced the typical mononucleosis, more antibiotics. So by the time I went through university, I was craving a lot of sugar, eating junk food, suffering from loss of concentration, that kind of thing. Experienced a lot of mood swings and was diagnosed with hypoglycemia, hypothyroidism. And I found myself in the care of Dr. Henderson, who ran a PMS clinic here, and for 2 years was treated with what was then a popular natural progesterone suppository. Then went into the doctor care of a clinical ecologist and found myself administering injections of allergy shots because PMS, allergies, and Candida are all related. And then by the time I was in my late 20s, fortunately there was an open house at the Natural Health Institute, and I was introduced to Jeff Levin. And after a long talk with the stars one evening on a New Year's Eve, I made the decision to do the cleansing program.
But you were taking, I mean, each day you were taking allergy shots and suppositories.
One was for a 2.5-year period, and then that ceased because the choice between taking a single shot or 7 or 8 suppositories, one seemed more attractive. What happened, though, is that Candida people become very porous. There's so many gut mucosa perforations that there's a chemical sensitivity to the environment. So as I moved departments and changed work and was exposed to paint fumes, the methyl mercury would go straight into the body and my ratios would change. So now, as an insurance company was supporting me to the extent of $10,000 in prescriptions a year, and the allergy shots went from 1 every 5 days up to 5 self-administered per day. And that's when you get to the point where you have a long talk with the stars and you say you're either going to choose to be healthy, and venturing into this whole area was very unusual and unfamiliar to me.
I mean, leaving conventional medicine and going off into a natural health field.
And I think that's part of the beauty of this situation, is that it is a great teacher, it is very compelling, and it has been, in a sense, my greatest friend, in that it is now, in the space of 4 years, taught me an extraordinary amount that is important for personal well-being, growth, self-development, and the balance of good, radiant, vibrant health.
So you've had this all, you know, up to the point where we're talking to the stars, because life really is getting to be not much fun anymore.
Not much of a choice.
And how long after you met Jeff, you went on this, how long did it take you to get healthy and well?
Yeah, this is important for people to understand in terms of developing realistic expectations. After the 7 days, I never touched another needle again. Being an extremely pragmatic and practical person, this was highly appealing to me. It took about 3 months to go through a leveling out process and become what I would say operational, functional, you know, join the human race again type of thing. And I think that people need time to integrate some of the adjustments in their life, be they living circumstance, get fresh water, new lighting, you know, air filters and things like that. The support. It probably took another 9 months to really regenerate the body and live with some of those adjustments and changes. And that can be a very normal, happy, balanced life as well. It's, people speak of the nutritional aspect. It's not from deprivation. Having gone through on Fig Newtons and potato chips and chocolate milk and pizza and that, those are things that the desire for them is just eliminated after you're not supporting the yeast. You know, your body is now supporting you.
Okay. You certainly do look healthy. I mean, you just radiate health, and you feel wonderful, and life is good.
And it's a vigilant process. I think that the body has got a natural wisdom, and if you give it enough room, it will express itself. And that what it did do is it taught me a lot about my relationship with the environment. And I noticed last night on TV there were 5 women, Meryl Streep, out there talking about our relationship to the environment. And it became very clear that you need to fill the body with nutritional food, and you have to learn a whole bunch of new things. And it can either be an adventure and something that is very life-supporting, or you can live with the burden of not choosing that.
How does one know if they have Candida? I mean, is there any definitive method here?
When I started to receive a lot of consults on Candida, I knew that I had to do something. So I started using a technique of blood testing, which to me is definitive and helps me. It's a Candida-specific antibody test, which I can do on a patient not covered by our Medicare plan as yet. I've done in the past several years over 2,000 blood tests, and I'm preparing a medical paper right now for a journal which will present my clinical evidence. To me, this is a condition that can be scientifically proved. If I can get some research funds, I'll do it faster, but this is the difficult part, an individual doing it on their own.
Obviously, you did the 2,000 blood tests because these people, or you suspected, or they thought that we're going to see if this is Candida.
Right.
Okay, out of the 2,000, how many had Candida?
They're self-selected, they come with a problem. Over 90% had the condition, whereas in a test of 5,000 patients, the general population, only 10% have high levels. So I get a lot of people with Candida. And I do the testing, I put people on programs, and I'm now working with a new system of homeopathic injections into acupuncture points on an experimental basis to try to boost the immune system. We'll talk about the treatment, and it is vigilance that's required. There is no cure as yet. But if we know how to work with the immune system, then we'll get a cure.
If Barbara goes back to the Fig Newtons, Twinkies, and the pizza, it'll
Yes, that's right.
Okay. We are going to continue talking about the treatment. Also, you, because you deal with the immune system, this is sort of like a catch-all. I mean, if these 2,000 people came to you, what could it have been? It could have been Candida.
Well, a lot of women, they do come with yeast vaginitis.
Right. Is that a major sign?
That is a major sign. They've had vaginal infections for years. 50% of the time, the swab doesn't even show, because when you swab for vaginitis, you put it on bacterial media, and it won't grow yeast half of the time, so you miss the diagnosis. So women are told, you know, they'll have all this discharge. It's obvious on clinical examination. The swab is negative. The doctor or the nurse says, oh, your test is negative. I guess you're okay. And then it's a vicious cycle. Oh, is this discharge in my head? So women will come with the discharge, with the fatigue. And the differential diagnosis can be from hypoglycemia, allergies, anxiety and depression, low thyroid, even problems with fertility. PMS is very big. What happens is...
What do you mean PMS is very big?
It's a big symptom.
Okay.
And I first became a consultant in PMS, but when I started treating yeast, the PMS people got better.
You had serious PMS too.
Well, the question was, I thought that the PMS was the real problem, and when I heard about Candida, I thought, oh, they've got it wrong.
They missed it.
Yeah, they missed it. The truth is that I think Candida is actually the mechanism, and for people experiencing PMS, it really shows us something about how the mind and the psyche and the body interrelate, and one affects the other.
We'll pick up on this when we come back right after this. This is a great show.